Sir, actually, we are waiting for the Honorable Vice Chancellor. Once he comes, then we will start the lecture. Good morning to all. Actually, Vice Chancellor is having some another work, so he is busy in that, and in between he will join. So, first of all, I would like to welcome all the participants who are in the high dignitaries, students, and research scholars from different parts of the country and throughout the world as a whole. I also would like to welcome the great speaker, Senior Professor Dr. M.B.R. Raju, and also appreciate for his kind acceptance to deliver a valuable lecture in this international webinar. Senior Professor M.B.R. Raju is well known in the field of psychology, not only in the country, but throughout the world. I need not to require to introduce him, but it is customary to say some few words regarding his achievement and academic career. Senior Professor M.B.R. Raju, at present he is the HOD of Psychology Department, Andhra University. He is the Director of Psychology Assessment. He had performed as Dean Academic Affairs and in charge Register, President of Indian Association of Applied Psychology, editor and scientific board member of reputed journal, European Journal of Literary Disability, Switzerland, and more. He has edited 15 books, and it is credited to him, already published more than one century and 1 decade of research papers. Already supervised 55 PhD research scholars and 9 MPhil received 15 awards, including Professor S.C. Sharma Memorial Best Research Award 2018. He already completed 8 major projects. He had organized 22 national international conferences and workshops in the area of applied psychology. He already visited certain countries and endeavor, including UK, Japan, Singapore, etc. With this, may I request Senior Professor M.B.R. Raju to deliver lectures so as to enlighten us regarding COVID-19, disruption of life process, impacting mental health. Before that, dear participants, I would like to suggest you that whatever the questions and answers you have will be picked up after the lecture is completed. So whatever the questions you have, you can put at Q&A chat box. So now over to Senior Professor M.B. Raju.
Good morning, my dear participants. Most respected head of department, respected my good friend, Dr. Kiran Singh, Associate Professor, Department of Clinical Psychology, Mizoram University, respected Mrs. Lahaming Awali, Department of Clinical Psychology, Mizoram University, the professors, these are scholars, the students, and the scientists. It's my privilege to share my research, my teaching, and clinical experience towards COVID-19. Today's my topic is COVID-19, disruption of life process impacting mental health. My dear participants, we had a bad experience due to COVID-19 in first wave. Now, Indian total population is 133 crores above. As per the population, we have less hospitals, less doctors, less nurses, less medications, and also very less psychologists in our country. During the first wave, the developing countries had heavy loss compared to in India. Then they have been started initiation towards medical and psychological support. For example, you take Government of America, US United States of America spend the crores and crores of rupees towards mental health. Coming into second wave, COVID-19, WHO and developing countries alarming to every country. Indian government is not taking such seriousness, so that India had loss compared to the other countries. your accepting is the way for our precautions are very important. Majority of Indian population were died due to mental health issues and lack of medical facilities include hospital beds, doctors, nurses, and psychologists, medications like medicines and oxygen supply. This is the background of the COVID-19. Coming into COVID-19. COVID-19 is not a serious disease. When we compare with the cancer, arthritis, HIV, diabetes, hypertension, heart attack, and strokes, it's very high in India. When compared to these diseases, COVID-19, it's not a serious disease. The acceptance is more important. We had experienced the first wave and also the second wave that started and slowly is coming down. And as per scientists, as per WHO, the government of India, ICMR says that the third wave is also there. But we are ready to acceptance is very important. So talking about the acceptance, what you are accepting is way forever is very important. The COVID-19 pandemic. Pandemic effects. One is psychological. Number two, social effects. Briefly, we will explain what do you mean psychological effects. The majority of the COVID-19 patients, psychological effects, number one, distress, anxiety, fear, phobia, guilty, insomnia, and depression. So here, you're all aware, 2 plus people were died in second wave towards COVID-19. Majority of the patients were died due to cause of psychological effects. Coming into the pandemic effects, second one, social effects. What do you mean social effects? Very briefly, I'll explain. One is social isolation. Either home isolation, anxiety, the fear, uncertainty, economic difficulties, stress, substance abuse, loneliness, mood disorders. So here, pandemic effects, psychological effects, social effects. Coming into the health and mental health. According to WHO, World Health Organization, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So here, physical health is more important. Today, more than 60% of the Indian population have been suffering with different physiological problems. When we're talking about the mental health, state of complete mental. What is mental? According to WHO, the second highest disease in the world, depression. When you're talking about in India, India is the first place. Number three, social being. Social well-being. You all aware the meaning of social well-being. What type of well-being we are? We are coming into, according to WHO, a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is also to make a contribution to his or her work, her community. Just very briefly, I will explain the well-being in which the individual realizes his or her own abilities. Realizes his own ability mainly based on education. By born, we are all intellectuals, irrespective of the caste, irrespective of the religion, irrespective of social status and social class. This abilities, own abilities is very, very important. Ability is mainly education. You know what type of education we have? About primary education or secondary education, the colleges and universities. Most of the faculty members like vacant till today in most of the colleges and universities. When you have good education, definitely you will know your own abilities. With own abilities, we can easily developing coping mechanism towards the stress. When you have a positive stress or a good stress, the good stress helping us can work productively, either institutions, either universities, either research, or industries. Work productively and fruitfully, and also to make a contribution to his her community. Our contribution to society. That is WHO definition. So coming into the mental health disorders can lead school failure, the college failure, the family conflicts, work-related conflicts, drug abuse, the violence, and suicide. Since last 2 years, most of the colleges and the universities closed. Some universities, some colleges, online classes. Most of the students or children have been suffering with mental health problems. And work-related conflicts. The people habituated drugs and the violence. And suicide is also slowly increasing. Coming into year 2020, depression is constituted the second largest cause of disease burden worldwide. The statistics is given by WHO. When coming into the causes of mental illness, the causes of mental illness, number one, psychological factors. What are the psychological factors? Due to cause of COVID, majority of the people have been suffering with severe psychological trauma. This trauma suffered as an individual such as emotional problems, physical problems. And coming into psychological factors, number two, loss of parents. I have seen number of parents who are died due to COVID-19. And the parents who are died, the small children alone, now they become orphans. In my state also, number of children become orphans. Now Government of India and the respective states is coming forward, initiating the children education and caring. And number three, neglect towards government precautions. This is a very interesting thing. From the beginning, the Government of India, ICMR, respective states asking, maintain mask. The mask is very, very important. And wherever you go, wherever you touch, sanitizer, use sanitization. And also social distance. But what I have seen in Andhra Pradesh, Visakhapatnam, in Visakhapatnam beach, more than 30 kilometers, the beautiful beach, hundreds and hundreds of people sitting on the beach without mask. Are they enjoying the beach? Now, the people, our students, or the public neglected towards government precautions. The psychological factors, number 4, poor ability to relate it to others. So here, the COVID-19, some of the people, when they're watching the TV, reading the newspapers, and some of the people, they're watching news from some sources in the net, lack of proper knowledge, lack of proper awareness, misinterpreting about the COVID, and also relating to others here. Suppose the neighbor, either family member, either friend, either colleague, affected COVID, or the COVID patient was admitted in the hospital, or if any patient taking oxygen, or some of the patients die. So when they see such information, are getting information and comparing with others. Comparing means I may have, I may get. So relating to others. Lack of proper knowledge. Knowledge is very important. So here, the people giving different informations, some scientific information, some non-scientific informations. And also, you know very well, Indian belief system, some people talking, okay, you need not worry about, you need not follow scientific information. You take cow urine. So sometimes some information is also not appropriately receiving, is not understanding, they are moving into psychological problems. It leads to mental illness. Coming into environmental factors. What are the environmental factors, the causes of mental illness? Death. Not taking care of COVID patient. Suppose the father and the child was admitted, or the father was admitted, the child is not allowed, the son is not allowed, or daughter is not allowed to see the COVID patient, is not allowed to talk to the death patient. Not only death, suppose one sees death, so they're not allowed seeing the death, the patient. Sometimes the body is not giving to home. From hospital directly taking, and they burn and they bury it. So without seeing the father or mother or the brother, see the pain of the father or mother or brother or neighbors. And dysfunctional family life. The feelings of inadequacy. The feelings of inadequacy means low self-esteem. So low self-esteem people, they started anxiety, they started anger, and also some of the people, they started the loneliness. Number 4, changing the jobs, loss of jobs, Since last 2 years, the jobs lost. Example, call center employees, the private job employees, the school teachers, the private colleges, the teachers, they lost their job, no salary. Not only the call center and software and the teachers in migrant employees. So in India, migrant employees are more. Just they think about their employment. They think about their basic needs. They think about their children education. This is environmental factors. Coming into 4, social or culture. Talking about belief system. We're blindly following belief system. Till today, some of the people, they're against talking about the science. They're against talking about the medicines, the media. So unwanted news, unwanted informations giving in the TV channels. Not only unwanted, they keep on showing deaths, admitted, vaccine is not available, or oxygen is not available, or beds is not available, or hospitals are not taking proper care. So when they keep on seeing such informations, it's directly touching or influencing to the common man and coming into substance abuse. The people, due to cause of the anxiety, anger, stress, they habituated or they take more substance abuse, alcohol, marijuana, and smoking. Coming into biological factors, one is genetic. This mental illness occurs from the interaction of multiple genes and other factors. Now I'm focusing COVID-19 patients, other factors. One is the stress. Number 2, abuse, the traumatic events. Traumatic events. So yeah, suppose when the female get pregnant, when the pregnant women that started, when they seeing their relatives, our colleagues, our friends affected COVID-19, they started the stress. And also the traumatic event, the first wave and second wave of COVID-19. Regularly they're seeing in the news, are hearing. Number 2, it's affecting into the forthcoming baby inside the stomach. Infections. Infections linked to the brain damage and the development of mental illness are the worsen of its symptoms, COVID. A pregnant woman gives new baby. I have seen in Andhra Pradesh, those who are affected COVID, the pregnant women, they think about the new baby, how much stress the pregnant women have. Once the baby is coming out, they think about the feelings, their emotions, and also see their happiness. And coming into another interesting thing, biological factors, lack of immune system. I'm as a psychologist, I've written lifespan development book. The lifespan development speaks from conception, the till date, immune system is more important. In every stage of life, and every stage of the life, immune is more important. Immune is very, very important. But today, when we affected COVID, the doctors asking improving immune system. Eat more veg or non-veg or dry foods. So, very beginning, when it shortens of the immune system, they think about their cognitive development, their emotional development, their psychological development or physical development. Not only that, when suddenly eat, is it possible increasing? And another interesting thing, my dear participants, stress kills immune system. In India, more than 60% of the population suffering with basic needs. So those who are suffering with basic needs and employment. So lack of nutrition food, the lack of basic needs, according to the Maslow, according to Sigmund Freud, and other psychologists talking about basic needs, the food and the water is very, very important. The year. So those who are having the stress, from every level we have a stress. So those who are not developing the coping mechanism, our immune system damages. Once immune system damages, when you are not maintaining proper informations like mask or sanitizer or social distance, easily you will get COVID-19. Once we affected, the government doctor prescribed the medications, stay at home and take. But when we have a stress, the stress killing the immune system. How to reduce, how to manage. But what I'm saying, psychology says acceptance. When you're taking proper medication, within 1 week, within 10 days, you'll come back into normal. But as a psychologist, the stress is very important. Stress is focusing very, very important. So stress kills immune system. And coming into another interesting thing, other factors, poor nutrition and exposure to toxins. Such may lead to role in the development of mental illness. Think about migrant people. Indian public policy speaking basic needs. The psychologist is also talking about basic needs and employment. How many people having employment? How many people having the basic needs in our country? So poor nutrition, okay, leads to development of mental illness. Coming into what is stress? Stress is a phenomenon of modern living. Is a modern living. All of us are victim of stress at one time or other. I have a stress, you have a stress. My level of stress is different rather than your level of stress. It prevails in each developmental stage of human growth, beginning from childhood to old age. In every stage, stress diminishes the output of function. Diminishes output of functioning. It causes generalized lack and dissatisfaction, suspicious, impulsivity, aggression in the behavior. Stress is tension, the strain or pressure from a situation that requires us to use, adapt, or develop new coping skills. Coming into stress is a response, an exaggerated and conditioned emotional response to a psychosocial stimulus. It generalized, characterized by disturbances in biological functioning, psychosocial functioning, and individuals' incapacity. What do you mean biological functioning? So the stress response, biological functioning, sleep damage, peptide system is damaged, digestion system damage, respiratory system damage, glandular functioning damage, the brain functioning, reproductive system. coming into stress is a response towards psychosocial things, psychosocial functioning, fear of impending disaster, always in a hurry, always in a hurry, setting unrealistic goals, unrealistic goals. We don't know when the schools are open. We don't know when the colleges are open. Suppose when we are going to be preparing a competitive examinations, when the government conducting examinations. Suppose when student appearing are going into America for higher studies. Now, Indian flights is not moving to America. They think about setting unrealistic goals. Tendency to show off, extravagance, avoiding social gathering. We have fear. The children are enjoying going to school, enjoying the teachers, classmates, play with the games. Classmates, they're playing the games. Suspiciousness. Suppose if they go to school, open the school. If the employee going to college or university or a industry, they have suspiciousness. I may get. And taking extra carefulness, lack of confidence about himself, finding faults. The COVID-19. Number 3, stress response, individual's incapacity. Disturbances in memory and concentration, inability to attend the office. Most of the teachers not going to the colleges and universities, and the people are not going to the offices, the home, at work. Software employees staying at home, doing the work. And people are those who are at work. The depression, some people have suicidal thoughts, some people have delusions, some people have been suffering with living and believing daydreaming. I see number of clients in my online counseling, including in unacceptable habits, overcompensated behavior. And the next, psychological impact of stress. Number 1, anxiety. Yes, I've written an article in Hindu in Times of India about COVID-19 people, trouble sleeping. They are not getting sleep properly. They're at home, irregular sleep. And daytime they sleep more. Nighttime they're not getting the sleep. And software, call center employees not getting proper sleep. The sleep disturbances. And they started irritations, irritability. They feel restlessness. And also trouble in concentration. They are not able to concentrate their work, their job, their performance. The poor focus, their work, their job. Loss of memory. These are all anxiety problems. Coming into COVID-19, fear, pain. COVID-19, fear, pain. People are consumed by fear of the virus, and that fear is killing more than the virus. The fear is killing more than the virus. What the psychology speaks, people are consumed by fear of the virus. That fear is killing more than the virus. Some people are influenced by misinformation on the social media. Taking unnecessary medications. Getting themselves hospitalized for mild symptoms. For mild symptoms, people need not admit in the hospitals. They were hospitalized. Fear of catching illness. Fear of catching illness causes anxiety, leads to panic and makes people hyper vigilant. The fear, due to this, there is a rise in patients with extreme anxiety disorders. People develop acute psychiatric illness due to fear of contracting COVID-19. The fear is higher among those living away home, and those working from home, away home, and those working from home. Example, corporate employees who are working from home are equally susceptible. There are many who are working, which is hampering their sleep. Me and Dr. Kiran Singh and me and one of my scholars together published 2 articles and published by Medical and Legal International Journal. Coming into COVID. Due to cause of the COVID, guilty. What do you mean guilty? It's a psychological problem. Guilt impacts a person's ability to function in daily life. As a friends and the family, the members that come to COVID, those left behind have to struggle with the grief and trauma, but also the feelings of guilt. The guilt living through sometimes traumatic experience, like pandemic, where someone escapes injury or illness while others are not, can cause a sense of guilt. The people feeling guilt, for example, they hardly sleep as they are guilty and rather spending time helping others. The feeling helplessness. When we heard about someone losing their life. Every loss felt personal. Restructure your cognition by turning guilt into gratitude. Restructure your cognition by turning guilt into gratitude, which we call as guilt. The friends coming into depression. So some of the people, they enter into depression. Some of the people enter into clinical depression. The clinical depression, some of the people enter into suicide. We are seeing in the India and outside India, suicide people towards COVID-19. You all aware the meaning of depression, sadness, the physical illness, unhappy mood, dark feelings, distress, poor work performance, lost their job and attendance. I have seen in Andhra University, the more than 65 employees were died due to COVID-19. The professors were died, the non-teaching employees also died due to cause of the COVID-19. Depression leads to clinical depression. Clinical depression leads to suicide. Just we'll see the symptoms of depression loss of interest in pleasurable activities, at home, at office, dissatisfaction with the family, withdrawal from social activities. They are not willing to going outside. They are not involved into social activities. Feelings useless or hopeless. Great concern. Hopeless means then people have started, the third wave started. Going to be start. We don't know when it's going to be end. Till today, we will not get complete vaccine. People are waiting for the vaccine. So the symptoms, sadness, crying, and worry, difficult in concentrating and making decisions, loss of appetite and loss of weight. So COVID, due to COVID, loneliness. Loneliness, people feeling sad, feeling so sad. The loneliness leads to unhappy about being socially isolated. The COVID leads to worry. You know, according to Government et al., individuals high on neuroticism are troubled by negative emotions such as worry and insecurity. Worry and insecurity. Today, insecurity about employment. This, according to Goldberg et al., neuroticism. The worried people feel very anxious. And some people self-harming, self-injury. 40 to 60% of the suicides. 40 to 60% of suicides. Self-harming, the behavior. Coming into mentalness, restlessness, feeling of mild mental discomfort, severe depression, anxiety, irritability, lack of motivation or focus, lack of motivation. Today, most of the researchers, teachers, not moving to the universities. They are not able to concentrate, they are not able to focus about the research. Common symptoms of depression. The feelings hopeless can stems from fear of failure, quit before try. Irritability. Symptoms of situational stress or anxiety and frustration. Coming into due to cause of the stress, physical effects of stress, tension, headache. I have seen number of clients to my online counseling, backache, the psychology, my research, I have done research, backache due to cause of stress. Those who are suffering with backache, they're taking the tablets. Stomach complaints, rapid breathing, excessive sweating, sleep deprivation, fatigue, blood pressure elevation, increased pulse rate, behavioral effects of stress, overeating and eating, staying at home, keep on eating, the weight is increasing, angry outburst, stress and frustration, smoking, due to cause of stress, alcohol, very big queue in Andhra Pradesh, lockdown, mornings 6 to 11 to 12 o'clock. The people, those who are habituated to alcohol, by 5 o'clock, they're standing on the queue for alcohol due to cause of the tension and the stress. Friends, Indian public policy speaks basic needs. Indian public policy speaks basic needs. What psychology speaks, what psychology theory speaks, and including me. The food is more important, nutrition food is more important, the water, the good air, And the shelter is more important. Do you have? How many of the people having the basic needs? Indian public policy, second one, employment. How many of the people wandering on the roads for the employment? The health policy in India 2014, that speaks India's new health policy, which calls for recognition of mental disorders and a more accessible and holistic treatment of mental illness, also possesses for decriminalization of attempted suicide. According to WHO, the World Bank speaks more than 40% of Indian population suffering with malnutrition problems. More than 40% of Indian population suffering with malnutrition problems. According to WHO, according to World Bank. Think about that. When they're suffering with malnutrition, think about the COVID. According to developmental psychologists, including M.V.R. Raju, says that more than 40% of the growth and the development of a human being is done during childhood. Growth and development of human being is done during their childhood. It's my research evidences. Lack of nutritional food during childhood, immune system damage, and also mental illness increases. Lack of nutritional food during childhood, immune system damage, and also mental illness increases, according to M.V.R. Raju. Friends, coming into coping techniques. Coping techniques. Live well. You live well. One, eat well. Eat well means good nutrition food, either vegetarian or non-vegetarian. Today, unemployment people, migrated employees, some people not taking their salaries month first, the first day taking 10 days, 15 days after taking the salaries. Think about eat well. But here, psychology speaks the well-being. One is eat well. Whatever the food is available in time, properly eat your food is more important. Maintain proper healthy weight. And number 3, exercise is more important. Proper exercise. If possible, you better do exercise at home, either yoga or small breathing exercise or indoor games. Sleep and tiredness. Minimum 6 to 8 hours. Sleep is more important. The sexual happiness is more important, no diseases. Please reduce alcohol. Quit smoking, stop smoking. Smoking is very dangerous for COVID. The healthy body is more important. And also, ways to well-being, the family relations, the family time. I have wonderful research evidences, my dear friends. Lot of research evidences, including me. The family relations also. The family disturbances, the wife and husband relations also leads to the stress. And also the well-being means family time. The minimum time is more important. All family members together have a breakfast or lunch or dinner, have a tea, have a talk, have interaction with a smile, closer relationships with friends, have a talk through phone, switch off the TV, spend time with family. If we keep on seeing TV, the tensions, the stress is increasing, so that spend time with family is more important. Family is giving happiness rather than the TV. Have a lunch with family and colleagues. Visit a friend or family members who need support or company nearby. Speak to someone new today. And practicing mindfulness, meditation, yoga, take hobby, be active, exercise regularly, and also walk with the mask. Coming to last, how to cope. Seek professional help. We have very good psychologists in our country, taking their help through online counseling. So counseling is very, very important. Psychological counseling is more important to manage stress, to manage anxiety, to manage depression, to manage fear, to manage guiltiness, and so on. Make lifestyle changes. Spend more time with your loved one. Make you happy. Trust your body, give it time to react to the illness. Limit your time scrolling COVID news. Limit your time scrolling COVID news. This is very, very important for us. Keep away from negativity. This is very, very important. What I have seen in my counseling experience, negativity, please away. And also practice relaxation techniques. Keep away from misleading information. Some people misleading about medications, about COVID, about first wave or second wave or third wave. Keep away from misleading informations. And last one is acceptance is more important. Allow, acceptance means allow yourself to give and process them. Friends, my dear psychologists, my dear senior professors and scientists, my sincere appeal to you and the government of India and respected states. A national-wide psychological assessments and interventions, national-wide psychological assessments and interventions is the need of the hour, and focus on key determinants results in lower rates of mental disorders and improve physical health and also better educational performances, greater productivity of workers, improved relationships within families, and safer communities. Once again, I'll tell you, my dear psychologists, learned professors, national-wide psychological assessments and interventions is the need of the hour, and focus on key determinants results in lower rates of mental disorders and improved physical health, and also better educational performances, greater productivity of the workers, improved relationships within the families, and safer communities. Thank you, one and all.
Thank you, Professor M.B.R. Raju, for the excellent and wonderful lecture on COVID-19 and disruption in life process. I hope it enlightened the cognitions of all the participants. Before the start of questions and answer, may I request our Honorable Vice Chancellor, Professor K.R.S. Sambasiva Rao, to say a few words. Sir.
Namaste, sir.
Namaste, Pradhan. Namaste, sir.
Namaste, sir. I'm just sorry I could join little late because of some communication gap. I did not know that today's timing. But I joined around 11:20, 11:15, sir. I've been listening and it was wonderful information, how people are psychologically feeling and how psychologically they have to get rid of the problems which they are facing now in pandemic situation. It was really wonderful. I have been seeing many messages in chat box. They were really appreciating your lecture and they are doing, it's a big number of more than 400 people, they attended the webinar and they were appreciating, all of them, they are appreciating your lecture. And it was really explained how people are actually viewing the COVID and how they are psychologically getting the problem and deaths also, how, and during deaths, how people are getting actually even almost panic. They are not able to see the family members and everything. You rightly explained everything and it was a wonderful explanation. And it was very informative and also people should understand what exactly they have to behave during this particular time, sir. Thank you very much, sir.
Sir, thank you very much attending and listening my lectures, sir.
Yes, sir. Yes, sir. Yes, sir. Thank you.
Thank you so much, sir, Honorable Vice Chancellor, for your kind appreciation and supporting us continuously in order to make this webinar successful, sir. So now is the time for questions and answer. I have some, I received some questions. The first question is from Venkata Subbaramaniya Ganpati. Her question is, women and children are most likely to report symptoms of anxiety or depression disorder during the pandemic. How can we overcome it?
Please, sir.
So
Women? Question is women. Please read out the question, sir.
And children.
Women?
Okay, sir. Women and children are more likely to report symptoms of anxiety.
I will read, sorry, you are not able to read the question also by seeing. Women and children are more likely to report symptoms of anxiety or depressive disorder during pandemic. How can we overcome this problem? This is what he was asking.
Yes, sir. Very good, sir. Yeah.
Yes.
See, normally, most of the women, what I have seen, I have written one book on serials. Normally, the most of the husbands not spending their valuable time with respect to wife. So when the husband spending minimum 2 hours in every day during pandemic time, not only spending, interacting with the wife, interacting with the wife is very important. Have a dialogue, have a talk, and have a lunch, a dinner, or the breakfast. This is very, very important. And also today, no schools are not open. So when the students, when they're going to the school, they're enjoying with the teacher, they're enjoying with the classmates, enjoying with classmates. And also when the children are going to the schools, afternoon time, they go for the games, different games, involving the games and enjoying the games. So the pandemic, when the children are at home, so here, at least the home games is more important. Either carom board or the chess, or we have a number of psychological games is available. The buy and play at the home. And the parents also spend some time with the children for the games, the small games. And also some plantations. Suppose those who are having any plantations or gardening have to do gardening work. And the family members, the wife, and especially women, or the children together have the small exercises, or yoga, or meditation, or the smiling interaction. These are all very, very important. And also, So nearby your house, you have a small playground with mass, at least minimum 15 minutes, 20 minutes, you have a walk and see the natural beautiness. Natural beautiness is giving happiness. This is also very, very important. But also ask them not to listen unwanted information, either family members or relatives or from the news. This is very, very important. So before concluding, the husband, the time is more important for the wife for happiness. It reduces the stress. Thank you, sir.
Sir, the next question from the same person, that is Venkata Subramaniam Ganpati, is that job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to suicide. How can we give psychological treatment, public guidelines to the affected person?
I understand, yes. See, we have very good, clear guidelines, Supreme Court guidelines. Supreme Court guidelines, psychiatrists, psychologists together to treat the patient is very important. Today in India, psychiatrists neglecting psychologists. When we go to the developing countries, psychiatrists the first refer to the psychologist only. Psychologists first diagnose the patient, and number two, when you're talking about the depression, cognitive behavior therapy, CBT. So 100% without medication, cognitive behavior therapy helps depression patient to control, to completely reduce the depression. Today, so without consulting psychologists, some of the people directly go to the psychiatry, psychiatrists giving medications, or some people giving shocks, you know pretty well. But when psychiatrists, psychologists together giving proper treatment, 100% cure depression problems in our country.
The next question is from Jaspir Kaur. The question is, how do I talk to my children without making them anxious?
Okay.
Is it audible, sir?
My children.
The question is, how do
I talk? How do I talk?
Yes.
I will repeat question. How do I talk? How do I talk to my children about without making them anxious?
Without making them anxious. See here, when we are spending with a smile interaction, smile, the touching interaction, the smiling interaction, the way you touch your child. Touch means not only the physical touch, psychological touch is more important. What do you mean psychological touch? The way you see, the way you talk. The way you talk means nonverbal communication, lips movements, your eye movements, your cheek movements, your forehead movements, your body language. It gives immense pleasure to the child. But when you have an anxious, okay, definitely your anxiousness directly reflects into the child. So when you're in a calm situation, when you have less stress, less anxiety, spending more time and interacting with not only physical touch and psychological touch, it gives immense pleasure. It gives happiness to the child. And also,
the next question is
also identifying their needs and expectations. According to their needs, their expectations, you have to satisfy with positive attitude.
The next question is from Sukanya Nagendra Kishore. So he stated that the sedentary lifestyle among children and youth is increasingly enormously during COVID phase. Observed as sports community psychologists, please suggest the psychological intervention for motivating the youth to be physically active. The question is, please suggest the psychological intervention to for motivating the youth to be physically active.
Yeah.
Is it audible, sir?
Yes. Very nice question asking Dr. Kiran Singh. In a similar way, very nice article I've written and published the Scopus and ICMR journal. That is called it as Legal and Medical Journal, Legal and Medical. Just December 2020 publication, December 2020 publication, Legal, Medical and Legal. Ask them to download my article and go through the article. You will get complete the picture and information about the question.
The next question is from VL Ram Lingai Ate. My questions might be difficult for someone, the feeling of relief and determinations to get a cure. That is having psychological strength to overcome any disease or disorder. Is there any rush or sudden change in the body, like the sudden strengthening of the immune system happen? Can we get to know more about the science behind how well-being has influence on the body? Slowly and gradually change occur in the body due to psychological well-being, but what I am talking about is a bit religious or suspicious, but it made me curious. I mean, when someone of any religions, even just for an instant, run away for all doubts and fear and get that faith or belief of behind, hell gets held. Is the rush of feeling of well-being in his or her psychological well-being that gets to change the chemical structure or biological functioning? Or is there a high power being responsible for this kind? Please give your honorable opinion, honest opinion.
Yeah, a really interesting question, very interesting question. See, the 2014, I was publishing a similar article. The difference between, very simple, what is the religion and spirituality? See, spirituality is different, the religion is different. Both are different. No doubt about it. They here. See here, my dear friends, here the first one by one I am explaining her question. Here, number one, first, we should accept the COVID-19. That today, there is no medication for cold. Till today, there is no medication for cold. Till today, there is no medication for diabetes. Till today, there is no medication for some of the cancers and HIV. What I'm saying to you, my dear friends, as a COVID individuals or patients, we should accept it. Acceptance is more important. Acceptance itself, we call it as, okay, 50% of the disease will decrease. So today, diabetic patients happily living, the cancer patients, HIV patients. They're taking medications. Some people taking insulin, they're also happy. HIV people taking ART tablet, good nutrition food, and psychological interventions. And they're living longer, more than 60 years. Even cough, there is no permanent solution. So what I'm saying, lot of research, rigorous research is going on for COVID disease. Acceptance is called it as a change. This acceptance, 50% relief, remaining 50%, ICMR, WHO, Government of India, precautions when we are taking, we are the happiest persons. Number two, nearby good psychologist, either personally you meet or online counseling, including mine. I'm also doing online counseling. You take online counseling, you're coming back into the normal. And coming into your last point about some people talking about religious. So in India, from years together, 1,000 years together, belief system, it is called as religion. Religion is different, spirituality is different. Majority of the Indians following religion principles rather than spirituality. Whatever you like the religion, whatever you like the religion. So you follow the spirituality. So when you have true spirituality, following spirituality is different, religion is different. So instead of following religion, truly, sincerely, seriously, involving into spirituality, your lifespan will increase. You are the happiest person on the earth. That is called as transcendental meditate. Whatever you like, whatever you like. So that we follow true spirituality rather than the religion. Whatever you like the God, whatever you like the God, you meditate inside. That we call it as transcendental meditate. Either Allah, a Jesus, or if you are not believing, if you believe the water, you believe tree, you believe flower, just you meditate. It gives happiness. It gives immense pleasure. Thank you.
We will pick only one question as the time is constrained. The question is that, so before the questions, I just want to tell to all the participants is that Professor M.B.R. Raju is the president of IAAP, and I belong to ISCP, that means Indian Association of Clinical Psychology, and I'm the fellow member of ISCP and as well as the IAAP, and what this two association is providing free online services. And if you need any help, any kind of counseling, then you can take the number of Professor M.B.R. Raju and as well as for me. So you can mail me or you can message me after this sessions. So the question is from Jayan Kumar Girl. What are the ways of self-care an individual can take who is suffering from mental distress? Over to you, sir.
Yeah. Self-care. The self-care, one is positive attitude. What do you mean positive attitude? Everybody's talking positive attitude. Very few people are following. The positive attitude, be friend. Be smile. Small if smile morning to evening. Wherever you work, to whom you talk, are reading, are walking, smile is very, very important. Be friend, be smile, be openness, and accept any criticism. And also, learning is very, very important. Learning is very, very important. You take Sarvapalli Radhakrishna, you take Dr. B.R. Ambedkar, you take Abdul Kalam, Rabindranath Tagore. Learning is a continuous process. Learning is a two-way process. Read good books. The good books always helping us self-care. And good books knowing your own ability helping us coming out from mental distress. And also spend more time with family members. And also, wherever you work with a positive attitude. to whom you dialogue. Have a nice dialogue. With your own interest, receive your job and accomplish your task the given time. These are all reducing distress, the self-care. So, and also government giving some precautions. Maintain mask, sanitizer, social distance is enough. These three enough. The reading, gardening, exercise, spending more time with family. These are all self-care. Thank you.
So may I invite MS Lalming Maui for vote of thanks. Lalming Maui.
Thank you, sir.
Before vote of thanks, someone is putting a chat box for announcement of next webinar from Mizoram University.
Sir.
There is a webinar on 5th June at 10:30 a.m. That is on World Environmental Day celebration on ecosystem restoration. Someone is it's already announced by our system administrator Soras Singh. Next webinar from Mizoram University will be on the topic of World Environmental Day, ecosystem restoration, scheduled 5th June at 10:30 a.m. Just you can go ahead, baby.
So once before vote of thanks,
Yes, sir.
I thank you very much, sir. Thank you very much for inviting
Thank
me
you, sir.
as a
Thank you,
speaker.
Thank you, sir. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you very much, sir. You can go ahead, baby.
Thank you, sir. Yes, a very good afternoon to all of you. I take this opportunity to thank our Vice Chancellor, Professor K.R.S. Tambasivarao, for once again giving us a platform to address mental health issues, which I think we all feel and agree is the need of the hour. Heartfelt thanks to our speaker, Senior Professor M.B.R. Raju, for your insightful and precise talk on the topic. And even without the PPT, your talk was very engaging. Thank you to the ICT department for the technical support. And finally, I would like to extend my gratitude to all our participants and listeners for your valuable time. Have a wonderful and safe day ahead. Thank you all.
Thank you, sir. Thank you so much, sir, for giving me the opportunity to serve.